Perfect Wishes presents foods and beverages to avoid during pregnancy. Pregnancy is a delicate and crucial period in a woman's life, requiring careful attention to dietary choices to ensure the health and well-being of both the mother and the developing fetus. While maintaining a nutritious diet is essential, it is equally important to be aware of foods and beverages that can pose potential risks during pregnancy. This guide aims to provide expectant mothers with a thorough understanding of potential risks associated with various food items, empowering them to make informed decisions for a healthy and safe pregnancy. This video will explore various items that should be avoided during pregnancy, providing clear explanations for their exclusion and highlighting the potential adverse effects on maternal and fetal health. 1. Raw or undercooked seafood. Raw or undercooked seafood, such as sushi, sashimi, and oysters, should be avoided during pregnancy due to the risk of contamination with harmful bacteria and parasites, including Salmonella and Listeria. These pathogens can cause severe gastrointestinal issues, posing a threat to both maternal and fetal health. If you're enjoying this video, please take the time to hit the like button and subscribe to the channel. Your support is very much appreciated, thank you. 2. High mercury fish. Certain fish, like shark, swordfish, king mackerel, and tilefish, contain high levels of mercury, a toxic metal that can adversely affect the developing nervous system of the fetus. Pregnant women should limit their consumption of these fish and opt for lower mercury alternatives such as salmon, trout, and shrimp. 3. Soft cheeses. Soft cheeses like feta, brie, camembert, and blue cheese may harbor harmful bacteria, specifically Listeria. Listeriosis, caused by this bacterium, can lead to miscarriage, premature birth, or severe illness in newborns. It is advisable to choose pasteurized cheese options to minimize the risk of infection. 4. Raw and unwashed eggs. Raw or undercooked eggs pose a risk of Salmonella contamination. This bacteria can lead to food poisoning, potentially causing dehydration and other complications during pregnancy. Cooking eggs thoroughly can eliminate the risk of Salmonella, ensuring a safer option for expecting mothers. Eggs should be thoroughly washed before cooking to reduce the risk of Salmonella contamination. Consuming raw or undercooked eggs can pose a threat to maternal and fetal health, emphasizing the importance of proper food handling and preparation. 5. Unpasteurized dairy products. Unpasteurized milk and dairy products carry a higher risk of bacterial contamination, including Listeria and harmful strains of E. coli. Pasteurization is a process that kills these bacteria, making pasteurized dairy products a safer choice during pregnancy. 6. Caffeine. While moderate caffeine consumption is generally considered safe during pregnancy, excessive intake should be avoided. High levels of caffeine have been associated with an increased risk of miscarriage and preterm birth. Pregnant women are advised to limit their caffeine intake to about 200 to 300 milligrams per day, equivalent to 1 12-ounce cup of coffee. 7. Alcohol. Alcohol consumption during pregnancy is strongly discouraged as it can lead to fetal alcohol spectrum disorders, FASDs. These disorders encompass a range of developmental and intellectual disabilities, as well as physical abnormalities. No amount of alcohol has been deemed safe during pregnancy, making abstinence the best choice. 8. Highly processed and junk foods. Consuming a diet high in processed and junk foods such as sugary snacks, sodas, and fried items can lead to excessive weight gain during pregnancy. This weight gain may contribute to gestational diabetes and other complications. Opting for nutrient-dense, whole foods is crucial for the overall health of both the mother and the baby. 9. Excessive intake of artificial sweeteners. While some artificial sweeteners are considered safe in moderation, excessive intake can pose risks during pregnancy. High levels of artificial sweeteners have been associated with an increased risk of preterm birth. It is advisable to consult with a healthcare provider to determine the safest sweetener options. 10. Unwashed fruits and vegetables. Fruits and vegetables should be thoroughly washed before consumption to remove any potential contaminants, including pesticides and bacteria. Consuming unwashed produce may expose pregnant women to harmful pathogens, affecting both maternal and fetal health. 11. Raw sprouts. Raw sprouts, including alfalfa, clover, and radish sprouts, may carry a risk of bacterial contamination, particularly with Salmonella and E. coli. These bacteria can lead to foodborne illnesses, posing a threat to both maternal and fetal health. Cooking sprouts thoroughly can help reduce this risk. 12. Highly processed meats. Highly processed meats, including hot dogs, sausages, and deli meats, may contain additives and preservatives that could be harmful during pregnancy. Additionally, these meats may be at risk of bacterial contamination. Opting for fresh, unprocessed meat and ensuring proper cooking can minimize these risks. 13. Excessive salt intake. Consuming excessive amounts of salt during pregnancy can contribute to fluid retention and increase the risk of high blood pressure and preeclampsia. Pregnant women should be mindful of their salt intake and opt for a balanced diet rich in whole foods to promote overall health. 14. Licorice. Licorice contains a compound called glycyrrhizin, which has been associated with an increased risk of preterm birth and developmental issues. Excessive consumption of licorice candies or supplements should be avoided during pregnancy to minimize potential adverse effects. 15. Raw shellfish. Similar to raw fish, raw shellfish, such as oysters and clams, can harbor harmful bacteria and viruses. These can cause infections and pose a risk to the developing fetus. Cooking shellfish thoroughly is essential to eliminate potential contaminants. 16. Excessive intake of vitamin and mineral supplements. While prenatal vitamins are crucial for meeting nutritional needs during pregnancy, excessive intake of certain vitamins and minerals, such as vitamin A, vitamin E, and iron, can be harmful. Consultation with a healthcare provider is essential to determine appropriate supplement levels for individual needs. 17. Herbal teas and supplements. Some herbal teas and supplements may contain ingredients that could be unsafe during pregnancy. Certain herbs have been linked to uterine contractions and potential complications. Pregnant women should consult with their healthcare providers before consuming herbal products. 18. Raw honey. Raw honey may carry a risk of contamination with bacteria called Clostridium botulinum, which can be harmful to both the mother and the baby. To minimize this risk, it is advisable to choose pasteurized honey during pregnancy. 19. Excessive intake of vitamins A and D. While vitamins A and D are essential for fetal development, excessive intake can be harmful. High levels of vitamin A have been linked to birth defects, and excessive vitamin D intake can lead to complications. Pregnant women should avoid taking vitamin supplements without the guidance of their healthcare provider. In conclusion, maintaining a healthy and well-balanced diet is essential during pregnancy to support the optimal development of the fetus and ensure the well-being of the expectant mother. Avoiding certain foods and beverages is crucial to mitigate potential risks associated with bacterial contamination, mercury exposure, and other adverse effects. By making informed and mindful dietary choices, pregnant women can contribute to a safe and healthy pregnancy, setting the foundation for the well-being of both themselves and their newborns. It is always advisable for expectant mothers to consult with their healthcare providers for personalized guidance on nutrition during pregnancy. Thanks for watching. Please like, comment, subscribe, and share this video with your friends and family. See you in the next video.